Social norms matter. As unwritten rules of behavior shared by members of a given group or society, social norms influence the behaviors and practices of communities everywhere. For programs that want to change existing harmful behaviors or form positive new ones, social norms can be an important part of program design, implementation, and monitoring and evaluation. But how do you identify the social norms affecting your programs? Recognize who or what influences those norms, and use that information to make your programs more impactful. The Social Norms Exploration Tool, or SNET, provides guidance, exercises, and tips so your team can quickly understand social norms, work with community members to discover what norms influence their behavior or actions, and use your findings to develop more effective programs in the communities where you work. Developed for program implementers, the SNET will help you answer 4 key questions. Who is most influential to your program's participants when it comes to practicing or not practicing a specific behavior? What are the social norms that influence this behavior? Why do participants comply with or reject these norms? And what norms have the most influence on these behaviors? Together, we'll look at 5 simple phases for rapid and participatory social norms diagnosis. Let's get started. Phase 1 is all about planning and preparing. Each activity helps prepare you to explore norms in your community. You'll start by reflecting on the root causes of your target behaviors and developing an understanding of the norms that affect your program. Next, you'll decide whether you need to segment your program's participants based on factors like age, sex, or social status. After that, you'll develop the objectives of your social norms exploration and choose the exercises to use in communities. Now is also when you determine the number of communities and participants to engage. And finally, you'll develop a plan that guides the preparations and logistics of working in your program community. You'll come back to phase 1 throughout your exploration as a reminder of your goals and objectives. In the second phase, your team will interview community members to identify the reference groups. Because social norms are context-specific, reference groups are the power holders and influential people that sustain community beliefs affecting social norms. You'll start by asking your program's participants questions about who gives them advice and influences the way they behave. Next, you'll quickly analyze the responses and decide which reference groups are most trusted in your community. Knowing who your reference groups are will help you make sure you're including the right people in your programs. In phase 3, you'll work side by side with local stakeholders to explore which social norms and other factors influence their behavior. You'll use a participatory exercise to conduct group discussions with your program's participants and your reference groups.
The Social Norms Exploration Tool helped us to gather information and insights on family planning and reproductive health from our community audiences using participatory designed approaches which were more engaging and interactive for our participants.
Talking with your program's participants and their reference groups allows you to tailor your program's social and behavior change strategies. In phase 4, it's time to analyze and interpret all your information to identify the social norms that influence behaviors and their importance for your program. Together, your team will rapidly analyze the information you collected to identify the norms that influence target behaviors, the weight of their influence, and the consequences of conforming to or violating them. Understanding the social norms at play in your program communities will help you develop the right strategies. In the final phase, you're ready to apply what you've learned to your program activities.
The SNET, because of how simple and straightforward it is, it has allowed us to build the capacity of of the REACH project staff in understanding research protocols and understanding some of those easy ways that you can get information and data around your project.
Your team will use your newly gained knowledge on social norms to design or adjust your program. Your team can use the SNET's sample program matrix or list of guiding questions to plan how you can apply what you've learned to your program design, implementation, and monitoring and evaluation. Programs around the world have already used this SNET to better understand and address the behaviors and practices influencing their community-based programs.
We thank
SNET activity which enabled our project to understand the key barriers for family planning uptake, which are emerging from deep-rooted social norms and reference groups who pose barrier to uptake of family planning. This has informed us, and we were able to review, refine, and contextualize.
You can use the SNET anytime in your program lifecycle, making it a valuable resource for shifting social norms.
We are hoping that when you also try the use of SNET, you will be able to improve your programs and share your learnings as well.
Download and share the SNET today.